Hey, this is Dr. John Mark Chesney, licensed physical therapist and owner of Simply Physio. I have a case that we're going to be going through, and we're going to be documenting her journey back to the pickleball court. I believe she is a 4.0 pickleball player. She was recently diagnosed with a meniscus tear, both medial and lateral meniscus tear. And she has decided, instead of going down the route of arthroscopic surgery and or steroid injections, that she wants to avoid those procedures and techniques, and instead she is going to get back to the pickleball court by pursuing a combination of stem cell therapy as well as physical therapy, so stem cell injections. And so we are going to document her process and share how we're going to help to get her recovered. So at this point, she has not had the procedure yet. That's scheduled actually for next week. And so what I want to share today is what is meniscus tear, what are signs and symptoms of meniscus tear, specifically about her MRI report, what were her findings, and some ways that you can test yourself to see if you may have a meniscus tear as well. So first of all, a meniscus is a piece of cartilage in between the two bones of the knee, so the femur and the tibia. And you have both a meniscus on the inside or the medial side and the outside or the lateral side of your knee, and they provide some cushioning ultimately for the knee. There's a few other purposes too. They help with some of the motion of the knee, but they give you some cushioning. And when they become torn or injured, they can give you problems. And so there's a few tests, a few things that you can, histories of signs and symptoms that might suggest that you have a meniscus tear. So one is a history of catching or locking. So this patient did have these symptoms that came on recently. She did not have a particular event that she could point to. She had taken a little bit of time off over the holidays, and then as she had picked back her routine, she started having some knee swelling. And pain associated and stiffness associated with it, as well as some catching and some locking. So the first sign and symptom that you may have a meniscus tear is any type of catching or locking in your knee. The second one is joint line tenderness. And so the joint line is where the meniscus is, and you may be able to yourself. I'm going to show you on my knee kind of where you find the joint line. And again, you may be able to find this with some certainty. But determining based on how well you can find the joint line. But I'm going to show you here my knee. So here's the front. So if we come here, so I'm up here a little bit higher. I can feel the bone. And if I come a little bit lower, I'm on the bone of the tibia, up here on the bone of the femur. So in between, there's for most people, going to be kind of a little divot. And I can kind of feel that divot around the side. So that's my joint line. And again, you may be able to find it there. And so what we're looking for is, again, do you have tenderness around the joint line? So I'm on the lateral meniscus right here. And then I can also palpate the medial side here. So again, I'm feeling the bone right here. Then right here, my finger drops down just a bit. And if I keep going further down, I'm back on the lower bone or the tibia. So I'm right there in between, and I can just trace around and see if I have any tenderness. So that's the second sign that you may have a meniscus tear. So the third one is pain with forced hyperextension. So this patient also had a positive sign for forced hyperextension. So if I'm showing my knee here, if I'm pushing it all the way down towards the floor, so I'm forcing it into extension. So my pressure is going straight down there. So she had, again, positive pain with this forced extension. So that's the third test that you can look at. The fourth one is just going opposite. So if I'm going into forced flexion, again, you may have a positive test. The fifth one is one that you really can't do on yourself. It's called the medial McMurray's test. It's something a therapist would really need to do for you. But there's research that shows that if you have 3 out of those 5 tests, there's a strong likelihood that you have some sort of meniscus tear. So you can do 4 of those tests, likely with some level of confidence yourself, just to give yourself a little bit more awareness or potential for understanding if you may have a meniscus tear. So that was what we found with her. Again, she had 4 of those 5 tests, and then she ended up getting an MRI. So I have her MRI right here that I'm going to read and talk about it just a bit. So it says the findings, there's a complex tear of the posterior horn and the body of the lateral meniscus. So the lateral is on the outside part of the knee. And then she also has a complex tear of the posterior horn and body of the medial meniscus. So both sides. A moderate-sized area of full-thickness chondral loss in the lateral compartment with subchondral cystic change. So chondral is a terminology talking about the cartilage, and it can be a sign of just a loss of some of that meniscus or cushioning, indication of more kind of joint or bone type of injury. So the articular cartilage is the cartilage that surrounds the bone. She also had a moderate amount of joint effusion, which is joint swelling, mild synovitis, which is inflammation of the synovium or the fluid around the knee. And then she also had a small to moderate Baker cyst. So a number of things going on there, pathology. You know, the interesting thing with a lot of people may have a meniscus tear and not even know it. But for her, she also had positive signs of loss of physical function, specifically her ability to play pickleball. So she is scheduled again for her stem cell procedure on Monday. So we are going to be documenting her progress. Next week, we'll be filming her first visit post the procedure, and then documenting things along the way. Our hope is to encourage people that there's other options besides going down the road of injections and surgery. Not to say that those aren't viable options, but with any type of procedure, we want to understand the risk versus the reward. Steroids, serve a purpose. Just a quick summary: they do a really good job of knocking out inflammation, but there's been concern specifically with the knee joint that they can cause a speeding up of deterioration of the tissue around the knee or in the knee joint. So actually her doctor who's going to be doing the stem cell surgery, they were very happy that she had not had any steroid injections because they told her that it improves the likelihood of her success with the treatment when she has not had steroid injections into the knee. So again, we're going to be documenting her progress. I hope that you follow along with us. So there'll be more videos to come. So check us out. If you're not sure where to find us, be sure to like our channel, and you'll be sent or more likely to find our videos for this patient, and as we document her progress back to the pickleball court. Also, guys, enjoy being part of this journey and documenting it for you guys. Thanks.